Acute chest syndrome, or ACS, is a severe complication of sickle cell disease. It highlights the complexity of sickle cell disease, where misshapen red blood cells can lead to a lung crisis. Immediate attention is crucial for survival. To understand ACS, we need to look at sickle cell disease. Sickle cell is a genetic disorder where red blood cells are shaped like sickles. These cells are rigid and sticky, causing blockages in blood vessels. Blockages in the lungs trigger acute chest syndrome. Pathogenesis. How does acute chest syndrome occur? ACS is caused by vaso-occlusion in the pulmonary vasculature, meaning sickled cells obstruct blood flow in the lungs. Often triggered by infection, common in children, increasing inflammation and worsening blood flow. In adults, fat emboli can occur after bone marrow damage during a sickle cell crisis. These blockages lead to inflammation and reduced oxygenation, worsening the obstruction. Diagnostic criteria. How do doctors recognize ACS? Doctors look for a new infiltrate on a chest X-ray, a key marker of ACS. They also check for symptoms like increased work of breathing, fever, or hypoxemia. Chest pain, often sharp, is another indicator. These combined findings help doctors identify ACS and start treatment urgently. Who is at risk? People with sickle cell disease are at the highest risk, especially during crises. Respiratory infections, surgery, and dehydration also increase risk. What would a chest X-ray show? In ACS, it shows a new pulmonary infiltrate, cloudy or hazy areas indicating inflammation or infection. Why is acute chest syndrome so dangerous? ACS interferes with oxygen delivery in people with sickle cell disease. Red blood cells can't transport oxygen effectively. This reduced oxygen transport occurs in the lungs. Left untreated, ACS can lead to respiratory failure and death. Treatment of acute chest syndrome. Treatment manages symptoms, prevents complications, and restores oxygen. Key components include antibiotics, IV fluids, pain control, and oxygen therapy. Acute chest syndrome is a pulmonary emergency demanding rapid intervention, especially in sickle cell disease. Early recognition and treatment can prevent serious complications. Remember, it impacts more than just blood, it affects the entire body. Early intervention is essential.